Good afternoon, everyone. For those of you who don't know me, my name is Sarah Lubarsky, and I'm the Executive Director of the Connecticut Women's Hall of Fame. Thank you so much for joining us today. I want to invite all of you to join us next Thursday, October 22nd, for our 27th annual, but first virtual, induction ceremony. Your voice, your vote, be remote to promote the vote, will honor the suffragists that fought tooth and nail for a woman's right to vote. During the evening, anyone who donates $50 or more will have their name automatically entered into a raffle to win this beautiful 5-pendant diamond necklace that you see me wearing. It's set in 14 karat gold with 20 round diamonds, courtesy of Fairfield Center Jewelers. The money that we raise on the night of the ceremony will help us support the educational programs that we deliver to students and citizens of Connecticut. Remember, we have no endowment, so it's people like you that keep women's voices in the forefront. For more information about the induction ceremony, go to our website at cwhf.org and look for the 2020 induction under events. We hope to see you then. Now I will leave you in the very capable hands of our founding president, Gina Clonan. Thank you, Gina.
Thank you, Sarah. And thank you, everyone, for joining us today. For nearly 3 decades, the Hall has worked to discover and share the stories of women. Our various educational platforms acknowledge the individual and the collective feminine voice. There's no more important time than now to talk and listen. This will be a half-hour intimate and informative chat, followed by 15 minutes of your questions, which I encourage you to submit at any time during this webinar by simply clicking the Q&A bubble at the bottom of your screen. We'll try to get to as many as possible. Our goal is simple, a virtual gathering to talk about today's important issues. We hope this to be a useful source of information while offering up helpful takeaways. We are so honored to have with us today Connecticut's former Department of Social Services Commissioner, presently serving as Acting Commissioner of Public Health, Dr. Deidre Gifford. Welcome.
Thank you very much. I'm very happy to be here.
Well, we're very happy to have you. And without further ado, let's just get right to the point. Can you give us an update of where we stand in Connecticut with the COVID pandemic?
Yes, I'd be happy to. So, as you all are very much aware, we had our most intense part of the pandemic in the late spring and early summer. Our cases peaked in April and started to decline in May. Things were very quiet over the summer, relative in particular to the rest of the country, but also relative to where we were. And in about the last month, since the end of August, we've started to see our case numbers and our test positivity, which are 2 of the numbers we follow closely. We've started to see those go back up a little bit. We are still in a very favorable position, as is the entire Northeast, vis-a-vis the rest of the country, unfortunately, but we are seeing an increase that we are watching very closely and taking steps to address.
Dr. Gifford, can you tell me if since the onset of this pandemic, have the metrics that we used changed at all? I'm referring in particular to this America's COVID warning system, which has us today at risk of an outbreak in the state of Connecticut. Can you explain those terms to us?
Yes, I'm not, there are lots of national websites that are sort of monitoring and tracking the states, and they all, unfortunately, use slightly different measures. But let me try to simplify a little bit for our audience. There's two things that we look at in general. One is how many cases are there in the region where you live? How many new cases of COVID, new diagnoses? There are some measures that look at that over a 2-week period, and some measures that look at that over a 1-week period, and some measures look at it per million population, and some per 100,000. We happen to use number of cases per 100,000 here in Connecticut, but generally that tells you how often COVID is being diagnosed in your area. The second measure is so-called test positivity. And that's a measure that looks at all the tests that were done, not the people in your state or region, but the tests that were done and how many of those tests came back positive. So that measure, goes up and down depending on how many tests you're doing. If you're doing lots and lots of tests and many of those people being tested don't have symptoms, your test positivity will be lower. If you're not doing as many tests, like we weren't, and none of the country was at the beginning because they weren't available, your test positivity is higher. So that one's a little bit tricky to interpret. And most states are looking at them side by side, kind of as dual indicators of where we are.
So do we also, as I understand it, look at the number of hospitalizations and therefore the number of deaths, which I believe have been going up just of late as we enter this fall season? Is that correct?
Yes, I'm sorry to say you are correct about that. Hospitalizations are another thing we track. They're what we call a lagging indicator because you don't start to see hospitalizations tick up until you've seen your cases ticking up for 2 to 4 weeks. So, but they are very important to track in terms of whether we have adequate capacity in our healthcare system to deal with the number of cases that we're seeing. Right now in Connecticut, we're in the around 175 to 200 in terms of individuals in the hospital with COVID. At the peak in Connecticut, we were around 2,000. So that will give you an indication that we're very far away from where we were in the spring, and we have more than adequate hospital capacity to deal with the uptick in cases that we're seeing.
Thank you for that, because, it is so stressful for all of us to be looking at these different numbers and not really understanding them or seeing them the way that you are privy to seeing them throughout these 7 months. And I think we all knew and expected a certain rise as we try to get our students back into their respective places. So for a moment, I'd like to talk about that because that certainly lends itself to all these new statistics. We're about 6 or 8 weeks into the school year with a variety of starts and stalls. In your July NPR interview, you were confident about the success of getting back to school. Do you remain so, and where do we stand today?
Yes, first I want to say to all of the superintendents, the school boards, the teachers, the staff, the parents and families of our kids in Connecticut. Thank you for the terrific job that you've done in getting our kids back to school. It's a very high priority for Governor Lamont. Anyone who listens to the governor and his priorities knows that reopening schools for both him and Commissioner Cardona, safely reopening schools, has been a top priority, and I've been very pleased to work alongside them to accomplish that. I'm a former school board member and chair from my town in my former town in Rhode Island. So this is a topic that's near and dear to my heart as well. We have seen a few cases, more than a few. We've seen a number of cases associated with schools, children and adults associated with schools. And the Department of Education is reporting those on a regular basis. What we haven't seen, and this is why this is a long way around to answer your question about whether I remain confident, and the answer to that is yes. What we haven't seen is outbreaks that appear to be attributed to transmission within the school itself. We don't see large numbers of children, for example, who have passed the infection to one another in the school environment, nor have we seen situations where we think children are passing the infection to the adults or vice versa. With very limited exceptions, we continue to see this is a child in the school, and the school closes for a period of time until they can do the contact tracing and make sure that no one else is tested positive and then reopens. But we, like I said, we have not seen yet what appears to be school-based transmission. The reason why we think that's the case is because we are told that students and staff and faculty are doing a terrific job with the mitigation strategies, the mask wearing, the hand washing, the distancing. And so I think that's something to be very proud of. And I think it's in the best interest of the kids. We have a large proportion of kids in some form of in-person instruction. The majority of our towns are either in hybrid or full in-person instruction. And I think we can all agree that that's good for kids' physical and mental health and development.
It is. And someone recently said to me that our teachers and professors are the frontline workers for all of our students. And it is true. And I too applaud their efforts. It has been tremendous. And certainly they're doing an incredible job. You talk about students, but particularly at high school and university level, we're getting reports because they're much less committed to social distancing, mask wearing, and avoiding large gatherings. What is the state doing to try to improve their behaviors?
Well, we have been working all summer really closely with our institutions of higher education, both the public and the private institutions. And again, I will give a shout out to all of them for their efforts. So they started planning, and President Ojakian will tell you that they started planning this work back in the spring, really as soon as the pandemic started to wane. They began thinking about reopening colleges and universities. And so each of them put together a plan. That plan included how and if they were going to test their students. It included plans for isolation and quarantine if a student became ill or was a contact. And it included all kinds of plans around communication and education for the students. They all had plans when they were bringing students in from out of state under our travel advisory. They had plans to quarantine those students for 2 weeks so that they were sure that they did not have COVID before they began intermingling with other students. And a very, very long list of extensive other activities that they've done. All that being said, we have seen outbreaks, as you know, and we're monitoring a number of outbreaks in institutions of higher education. So we have assisted them with testing resources. We've been helping to train them on their contact tracing. We've been helping with education, making links with municipal authorities in the towns in which they're located, which are very important. You know, most of the universities, and I will point to UConn here, have turned this around when they've had an outbreak. UConn has had a number of days with 0 cases and I think a week or so with very, very few. So even though they started out with a number of cases and had to quarantine a dorm or two, they seem to have, and those students seem to have gotten a handle on things.
Again, good news and promising news for all of us. We can't talk about the pandemic without talking about contact tracing, which you just mentioned. I know it started out a bit rocky, but how are we doing now?
Right. So, you know, there are many things about being the health commissioner in this time of which I am very proud. And I think I would point to this as one of the accomplishments of our state that I most want to acknowledge. There are numerous things to acknowledge of the tremendous staff, but we did stand up a contact tracing system really from scratch back in May. Contact tracing has always been done in public health. It's the bread and butter of public health, but usually it's a small isolated outbreak that we're talking about, and the local health department starts doing the work and they collaborate and coordinate and get assistance from the State Department of Health if needed. But this level of population-wide contact tracing really was something that we did need to start up from scratch. So there were a few bumps in the road when we were standing up this new IT system, as there always are when you're standing up a new system, especially under emergent circumstances. But we have now a staff in place. We've got a contract in place with a third party to hire full-time contact tracers we've had hundreds of volunteer students in health-related, usually graduate degree, but some undergraduate degree programs, who have done absolutely fantastic work with contact tracing. They've been an amazing resource for the state. We are now reaching out to almost 100% of people in our contact tracing system within the first 48 hours after their test is diagnosed. We're not getting as many contacts, names of contacts, as we would like to see, so we encourage people to share that information. It's kept confidential. And then we're reaching out to the contacts within 48 hours. So we are doing really well with our contact tracing. We're continuing to build that workforce as we need to now with the cases going up. But things are going very smoothly.
Well, congratulations to all who have worked so hard on that effort and continue to do so. You know, we're all pretty scared of winter for the first time. And schools particularly, you know, bring about problems for most all of us, whether we're grandparents or parents or friends or teachers or professionals or involved with the properties. So we know that some institutions of higher education might have some extended breaks to sort of address that, particularly around the holidays and people going home and coming back and forth. Would that be something that parents might see for K through 12 toward the end of the year, or how do you see any of the winter challenges?
Right. Well, I think it's a little different between higher ed and K-12, because obviously with higher ed, you have the students living on campus and then going back to either in-state or out-of-state locations and then returning. So there's some logic to those extended breaks. I'm not aware of any significant changes in the vacation schedules for K-12. I think that's a question Commissioner Cardona might be better positioned to answer. But I think because our K-12 students are, living with the same families and individuals that they are during the school year, there's maybe not as much impetus to do it at that level.
Understood. Well, we are the Connecticut Women's Hall of Fame, so I'd like to talk about women and the crisis burdens. 40% of U.S. businesses are women-owned. Pink-collar workers make up 55% of the workforce, 78% of healthcare workforce, 66% of caregivers, and 77% of teachers are women. This period of the pandemic has been coined as a she-cession as compared to a recession, underscoring the fact that more women are out of work than in past economic downturns. Dr. Gifford, as an obstetrician, gynecologist, and a public health scholar, you know better than anyone the extreme challenges facing women during this crisis. What has been your focus with regard to helping women in Connecticut?
Well, I think anything that we do to moderate the effects of the pandemic helps both the economy, and for the reasons that you so aptly stated, helps women. There's been, more and more evidence that even though at the beginning of the pandemic, we needed to do these sort of pretty profound closures in order to break the cycle of transmission, that now it seems pretty clear that the more we can do to keep our cases down, you can keep more of the economy open. And so it's this dual approach that, under Governor Lamont's direction and alongside Commissioner Lehman from Economic Development, we are taking, which is gradually, slowly, carefully open up our economy. And the vast majority of our economy is reopened in Connecticut. But at the same time, focus on science and safety and public health. And those two things, rather than being in conflict, actually are mutually supportive. So, I think everything we do in public health is aimed at getting us back to as normal as we can be as quickly as possible, which I think, to your point, will help women for all the reasons you articulated.
Exactly. And I can't think of a woman who could possibly be under more stress than you are in your job. What do you do to keep mentally and physically healthy in this environment?
Um, well, like most doctors, I'm probably not very good at following my own advice. I will confess that. Um, so I have a wonderfully supportive family, uh, without whom I could not do this job. Um, my husband, David Gifford, is a former health director from the state of Rhode Island and was actually the health director during the H1N1 pandemic. So he knows, he's walked in these shoes, and he is a tremendous support, and on many days brings me breakfast, lunch, and dinner where I'm seated because I don't have time to get up and eat. And I have a wonderful, wonderful son who was with us for a number of months in the toughest parts of the pandemic and was absolutely enormous support to both my husband and myself. So the answer to your question is I rely on my family. Texting and Zooming and all those things to keep close. I have a close group of women friends that I don't see as often as I would like, as all of us are in that situation. But we try to keep close through email and other kinds of correspondence. And that's honestly what keeps me going.
Well, certainly we're all looking for our chains of support. I guess where you and your husband are concerned, you never can not talk shop.
Well, we try, believe it or not, we try not to talk shop because both of us need a break.
Of course. So I think I want to look ahead once again to the seasonal challenges and talk about those realities, possible infection surge, COVID fatigue, indoor living and socializing, possible twindemics, and all these vaccine predictions. Can you comment on any of that for us as we head into the latter part of the year?
I think we should take this one day at a time. I understand the anxiety and sometimes kind of overwhelming nature of the news. Combined with a chaotic and tumultuous political season, all of this health news can be really, really stressful. And when you pile on economic stress that many people are experiencing, it can be a lot. I think the taking steps ourselves, empowering ourselves is an important thing to think about. There is a lot that we can do to keep ourselves and our families and our communities safe. And sometimes I think now it feels like everything's just happening to us and we forget that we do have a fair amount of agency here. And so, we have learned a lot of things, but one thing we have learned that's pretty clear is that we can keep ourselves safe. And be out in the world. The mask is enormously important. The physical distancing is enormously important. Limiting being in crowded areas is enormously important. And if you do those things, you can get some normal-ish types of experiences. And I think it's important for people to do that, to get out and walk around. Again, I don't always follow my own advice. But take those safety steps, take them very, very seriously, but then try to have some sense of normalcy, and I think that will help.
I think it will too, and I was reminded in my conversation with Commissioner Cardona, we can proudly say Connecticut's a state that listens to the science, adheres to the science, and promotes the science, and I think we can all celebrate that. And even though people are getting COVID fatigue, you just reminded us it's not that hard. It is different, but it is still the mask, the social distancing, trying to gather outdoors. And speaking of which, I just read where New York's governor, actually I think it's New York City's mayor, has allowed restaurants and businesses to sort of move outdoors even through the winter months. You know, they have those great heaters and yurts and all of that. Do you think we'll see some of that too? Because I know most of us, it's cabin fever more than anything. So
Yeah.
just getting outside is a big deal.
Yes. Definitely, I'm glad you brought that up. We definitely encourage people to get out and enjoy, even if it's chilly, outdoor activities. I know Commissioner Lehman has been working with the restaurant industry on how to make it through the winter with outdoor dining. And, you know, making sure that the outdoor venues have adequate circulation, which is obviously the benefit of being outdoors. So I know there's lots of conversation and work going on there. And I hope that our restaurant industry is able to do that, because for all the reasons that you mentioned, it's safer and it's good for all of us to have a place to go.
Listen, I just saw, you know, these things that go around on social media, someone saying, you know, if you're looking forward to Christmas and buying gifts, buy gift certificates to your local businesses. You know, spread the word. Try to support everyone who's struggling through this crisis in one way or another. And I thought that was a really good idea. Instead of buying things, you know, find ways to support our communities.
Yeah, that's a terrific idea. There are going to be a lot of people in need this holiday season, so it's a good reminder.
Well, particularly where food insecurity is concerned. And I know that with Thanksgiving and Christmas coming up, we should all be reminded that the healthiest holidays are the well-fed holidays. So if everyone can be thinking that way. There was a recent food drive at Operation Hope near me in Fairfield. And it was just so easy because I just went into my pantry and cleaned a lot of things out that were still perfectly good items that we hadn't used. So think you don't have to think about having to go out and buy and spend money. Sometimes the greatest gifts are right in your own backyard.
Yeah.
I want to encourage people to put their questions in, because before long we will be talking about that. But I don't want to leave our last question without asking you your opinion on vaccines and the future of vaccines. Because again, we're all very confused. We get hopeful one day, we get discouraged another day. What would you tell us?
Well, I would say about vaccines in general that they are safe and they are effective. Most people probably weren't around to remember what it was like before some of the most serious epidemics around the world were curtailed with vaccinations. I'm old enough to have known people who were affected by polio, for example, and my mother would tell stories about her own childhood and needing to be restricted because of polio outbreaks among her friends and neighbors. So that's very real to me. That's something that younger generations don't think about. Measles, mumps, whooping cough, all of these things that we don't encounter with frequency anymore have been eliminated because of vaccines, and the vaccines are safe and they are effective. Influenza, every year getting a flu vaccine, all of us should get one, and in particular this year. Flu vaccines are effective. They don't prevent every single case of flu, but they prevent most. And if you do get the flu after a vaccine, it will be a milder case in all probability than if you hadn't been vaccinated. And you can't catch the flu from getting a vaccine. So vaccines in general, you'll be hard pressed to find a doctor who doesn't support them 150%. With respect to the COVID vaccine in particular, the research is ongoing, and we don't know when or what that vaccine will look like. I have confidence in the career staff at the FDA. I have confidence in the physicians at the CDC Advisory Committee on Immunizations. They are extremely knowledgeable and professional and ethical individuals, and I think that we should all have confidence in the apolitical scientific process that will come behind this vaccine. Our advisory group, the governor's advisory group on vaccines for Connecticut, will be looking at that vaccination approval process and advising the governor as to whether they think it followed the usual processes. I'm confident that it will. And when a vaccine is approved by the FDA, I intend to have one. I intend to encourage my family and my son to have one. So I think, time will tell when that happens. But I think we should have confidence in the process.
Well, I think, vaccines is a topic that probably outside of your profession, those of us laypersons, we never talk that much about it other than when our children were younger. And now it's on the news every day. I was interested to learn that when you hear about a trial being stopped and then started again, that happens all the time, but we never got that news. And we were never privy to that. No one ever cared. And now you go, oh my God, they're not going to be able to do it. It's stopped. But that's very common procedural process, right?
That's right. And I think the public should actually be reassured by that, because what it means is they're closely tracking events that happen. They stop the trial. They want to make sure and they learn or understand whether the event was related to the vaccine or not. And then if appropriate, they resume. So that's part of, as you mentioned, that's part of the normal procedure in these trials. And it's a good thing.
Great. I'm going to start with some questions, Dr. Gifford. And the first one, I think, speaks to you both as the Commissioner of Public Health and as former of Social Services. This is a very long question, but a very good one. This pandemic has clearly demonstrated that institutions, especially nursing homes and prisons, have inadequate services, resulting in suffering and death. Lack of services in the community is a major cause of institutionalization. Then state budgets tend to balance by reducing or eliminating services to low-income, elderly, disabled, and marginalized people. Do you agree, Dr. Gifford, that more community-based services would save lives and make positive differences for the future?
Well, I do agree that if an individual with disabilities or functional limitations can safely live at home and wants to live at home, that we should be able to provide them with those services. We actually do a very good job of that in Connecticut. We've been working for over a decade, long before I arrived on the scene here. We've been working to so-called rebalance and allow people to remain at home in the community under the Medicaid program if they can do so. There are always going to be people who need a nursing home level of care if they have extremely complicated cognitive or physical limitations and just can't be cared for at home or don't wish to remain at home. So I think there's always going to be a place for nursing homes. But I do agree that more community-based services is an important goal. Governor Lamont supports that goal, and we have continued to work on that since I arrived here last year.
Well, as someone who really supports age in place, I hope that we can see more of that in the future, not only in Connecticut, but across the country as a whole. Yeah. Here's another question. Dr. Gifford, can you speak about mental health resources that are available for those who are most affected in the pandemic?
Yeah, it's a really good question. I'm glad that that our participant brought that up. This pandemic has really exacerbated for those of us among us who have an underlying anxiety or depression, for example. This pandemic has been tough. The opioid crisis continues and has in some ways been exacerbated during the pandemic. But there are resources available, and our federal partners have continued to provide grants to our Department of Mental Health and Addiction Services. I encourage everyone to go to the website for the Department of Mental Health and Addiction Services and look at a variety of resources and supports that are available. They are extensive for all kinds of mental health and addiction challenges. Anybody can call 211 if that's easier. And 211 is very adept and very familiar with all of the resources available in Connecticut. So if you've got a mental health challenge, you're not alone, and there are resources available, and I encourage you to reach out.
And I will remind our audience that today's webinar is recorded and will be available on our website within a day or so, and also links to provide you with the information that you may need, links such as 211 and other services available to you at this time. Another very good question is that so many of the typical medical checkups and processes that have been deferred during the COVID are being deferred during the COVID crisis. Do you expect to see a large increase in serious medical conditions as a result?
It's a really good question. There has been some, suggestion in the medical literature that people have been suffering more serious consequences of their chronic diseases because they have not sought care. I would say to our audience that it is very safe to go visit your healthcare provider and get the checkups that you need. They have, for anyone who has visited a healthcare provider during the pandemic, you will have experienced that they've put in place protocols for distancing, for mask wearing, for gloves and sanitation. And so I think people should feel confident that if they need to see their doctor or provider, they should. The other thing I will say is that we've seen a huge increase in Connecticut and around the country in the use of telemedicine services. And I should have mentioned that when we talked about mental health, because that's been a place where it's been particularly useful. And our behavioral health providers are telling us that they're seeing more people keeping their appointments, more people reaching out because they can use telehealth. And also hearing from other medical providers that they're better able to, in some cases, help people manage their chronic disease because they can see the physical environment where that person is living, and that helps them understand their challenges in managing their chronic illness. So that was a long way of saying that, yes, there is some indication that some chronic illnesses and maybe even some deaths have gotten worse during the pandemic, unrelated to COVID, because of people not seeking care. And I want to encourage people and reassure people that it's safe to do so.
I think the telehealth movement, so to speak, is here to stay. And I'm so glad you brought it up. We don't have like a telehealth helpline or anything to see who you can connect with or like that. Right?
Yes, many health insurers do. And so if you have commercial health insurance, you could certainly reach out to them. I know Medicare, for people that are covered by traditional Medicare, they issued some new guidance this week about telehealth services that are being covered by them. And at Husky, our Connecticut Medicaid program, you can certainly reach out to our contractor at the number on the back of your Husky card for information about telehealth services through Husky.
That's great because, it's something most of us probably hadn't engaged in before, but I have. It's really easy. It is, as you say, so great. You don't leave your own home. If they ask you for something that you forgot to bring to the office, like your list of medications or whatever, you can run and go get it. It's comforting. It's just great. And I don't think it's going to go away. I think a lot of people have found that this is a new way to stay healthy.
Agreed.
Okay, there is one more question. This talked back to, when we were talking about the metrics used and where we are presently with COVID in the state of Connecticut. Are we on phase 3 of opening, or what phase are we on? We're on phase 3, right?
We did, yes.
So this woman asks, we're moving toward fuller in-person schooling where, we're in this phase 3. She says, wouldn't it make more sense to give things more time to see if the positivity rates continue to increase? So some people think, should we hold back before we move forward? And what would you say to that?
Well, I would say the governor did announce last week that for some towns that are at the higher levels of infection, that they do have the option to move back into phase 2. So that option now does exist at the town level. And I would also, I guess I would go back to my comments about our own, each individual person's agency and how to react. That there are things that all of us can and should do when we see infections going up, particularly for people that might have an underlying chronic illness, people over a certain age, 60 or 65, who are at higher risk of severe complications from COVID. People like that should take steps as the infections go up to limit their exposure, maybe reduce the amount of time they're spending with others, stay at home more, maybe only dine outside instead of the indoor dining, those kinds of things. And I would encourage people to take those steps.
Thank you. This will be our last question. And I think it's another good one. Do you recommend an antibody test to be included in your annual physical exam? What benefit would that have other than informational?
That is an excellent question. There is no recommendation for an antibody test to be given at an annual physical. I don't think I would see the use of that at this point in time for a number of reasons. One is we don't know exactly how to interpret those tests yet. We don't know how long immunity may last. There's all kinds of different antibody tests on the market, and each of them is slightly different and need to be interpreted differently. So I think that the use of those tests right now is more for research purposes. You might have seen that we've done a couple of surveys in Connecticut about antibodies that give us some sense of how many people may have been infected over the course of the pandemic. But on an individual level, kind of hard to know how to use that information right now.
All right, so I have one last question. Before we leave, could you give us some words of wisdom and comfort, perhaps those that inspire you to carry on?
That's a good question.
Some of us have a mantra, this too shall pass, carry on, different things that just, we have to remind ourselves to be hopeful and to move through this process, because it isn't forever.
Yeah, well, that is true. There is light at the end of the tunnel. I have to, you asking me that question about my mantra, it just reminds me of my dad, who always saw the bright side of things. He had a tough life in many ways, but when one of his 5 kids was down in the dumps, he always would encourage us to think about something that gave us joy or pleasure. His way of saying it was think beautiful thoughts. And that got us, it's a simple piece of advice and maybe a little simplistic, but I think that attitude has sort of guided me through my life and is getting me through this time right now, is just try to find something that you see the window behind me, which is some beautiful brick windows in my house, and I look at that every day and it gives me tremendous pleasure. And I think about the people who built that and all the pride and joy they took. So I just try to find something small every day that gives me a little bit of pleasure before I go back to the COVID.
Well, thank you, Dr. Gifford. I remind our audience to think beautiful things. That's a great way to look at this situation we find ourselves in. I thank you all for joining us. I hope to see you again when I host another webinar in a couple of weeks. And I remind you that this was recorded. It's available for you, your students, your family to watch online at www.cwhf.org beginning tomorrow. And we will have some useful links for you at that time. So to everyone, we're signing off from the Connecticut Women's Hall of Fame. Thank you and have a great day.
Thank you.